Did you know not everyone needs every fertility test? Some tests are skipped on purpose, not because doctors are careless, but because doing too many tests can actually delay treatment. In the last video, we talked about which fertility test comes next. Today, let's talk about something just as important: which fertility tests can be skipped, and when. This will help you avoid unnecessary stress, cost, and confusion. Why doctors don't do all tests together. Fertility testing is step-by-step, not a checklist. Doing all tests at once increases anxiety, increases cost, often gives information that's not needed, yet doctors only order tests that will change the treatment plan. Tests that can often be skipped initially. Advanced hormonal panels. If basic hormones like a MH, FSH, TSH, and prolactin are normal, advanced hormone testing is usually not needed at the start. Genetic tests. Initially, genetic testing is not routine. It's usually done only if repeated IVF failure, recurrent miscarriages. Strong family history. Most couples do not need genetic testing early on. Tests that are skipped if basic results are clear. Laparoscopy. This is a surgical procedure and not a first-line test. It's skipped unless there is severe pelvic pain, strong suspicion of endometriosis, previous pelvic surgery, repeated treatment failure. If scans and symptoms are normal, laparoscopy is often avoided. Hysteroscopy. In many cases, if ultrasound shows a normal uterus, hysteroscopy is usually skipped at first. It's done only if fibroids, polyps, repeated implantation failure, abnormal bleeding. When tube tests can be delayed, HSG or tube testing may be delayed if you're very young, trying for a short time, ovulation is regular. No risk factors for blocked tubes. But before IUI, tube testing is usually mandatory. One big myth to clear: more tests equals better diagnosis. Right tests equals better diagnosis. Skipping unnecessary tests does not mean doctors are careless. Something is being missed. It means treatment is being tailored to you. What tests should never be skipped? These tests are almost always essential. Basic hormone blood tests, pelvic ultrasound, semen analysis. These form the foundation of fertility evaluation. Fertility testing is not about doing everything. It's about doing what matters next. Skipping a test can sometimes be the smartest decision, not a risky one. Trust the process. And always ask why a test is being done. If this helped you feel more confident about fertility testing, like, share, and follow for the next episode. Which fertility test gives the most answers?